Women were generally not studied in clinical research trials until the mid-1990s. As a consequence of that, there was a serious lack of information on the health of women. In the 1990s, things started to change, and they changed largely because the National Institutes of Health, the single largest funder of biomedical research in the country, changed their requirement that women be considered as subjects in clinical research. But research takes a long time, and it takes a long time to begin to include women and to study women and to learn. And it really wasn't until about the year 2000 and in the early 2000s that we started to see the beginning of new research coming out about women's health. And we're still only at the beginning of understanding what we need to know, both about women's health and about gender differences in health and disease. We started our program, Women's Health Research at Yale, in 1998. It began with a very generous gift from a private foundation, the Donahue Foundation, that was also committed to medical health research. Women's Health Research at Yale has 4 major component parts. The first is our pilot project program. And that program is designed to provide investigators with pilot money so that they can start innovative studies on women's health and on gender differences, gain the feasibility data they need to go on and apply for larger grants and answer more definitive questions about the health of women. The second part, or second component part of women's health research at Yale, is our involvement with the community, reaching out and partnering with the community so that we can provide the information that people need to know about developing findings in research. The third major component of our work is to build our own, what we call research cores. And our research cores are really dedicated to bringing together scientists from different disciplines who will work together on a particular large problem. So for example, our cores focus around topic areas like cardiovascular health, women in trauma, and women in addiction. All of these areas really have been understudied and really need our attention. And the fourth major area of our efforts, the fourth component part of women's health research at Yale, is training the next generation. We're very committed to helping junior faculty, postdoctoral students, undergraduate students begin to learn about how to do research, and most specifically, how to include gender in that work. Once we began the program and we saw the tremendous interest on the part of scientists, we started talking to the community as well, and we saw that people really reached out for information about women's health, women and men, but primarily women interested in women's health and gender differences. So we also made a big commitment to communicate our findings to the community, and doing that really not to just tell the community what we knew, but to partner with the community and ask the community what was needed and how they needed the kind of information from us that we had. We're interested in engaging the community in a whole variety of ways. We offer a newsletter that goes out quarterly. We have a wonderful website and invite people to our website. We also are involved now in social media, so people can contact us through Facebook or Twitter. But we want to reach out in various ways that are comfortable and familiar to people of all different ages, no matter where they are in the country and even outside the country, because our reach has not only become national, but has begun to become international as well. The program is funded by the grants that we receive, as well as through an annual appeal, which really is tremendously important to us in covering our operating costs every year. In addition to that, we're very interested in building our endowment. We have already begun in that regard and are very excited about seeing that as a source of revenue over time. So a program that really directs our focus on women's health and on gender differences exists in perpetuity.